I'm Dr. Bott. I'm a radiation oncologist here at CCare in Fresno, and my practice includes a wide range of cancers. Today, I'd like to tell you a little bit more about prostate cancer and go over some questions that a lot of my patients have. So, there's a few tips I give a lot of my patients who are going to be undergoing radiation for prostate cancer. Two of the biggest ones include coming in with a comfortably full bladder, both for the planning scan and for the daily radiation treatments. We make a radiation plan to deliver a very high dose to the prostate and the target that needs to be treated, and sparing the nearby critical organs. But the way the bladder is, if it's empty, it's kind of like a balloon. If our high dose area is right here in the middle on the prostate and our bladder sits right on top, when it's full, it expands away from the prostate, away from the high dose radiation. Now, if it's full, it'll collapse right on top of the prostate and get closer to that high dose area. So I explain to patients that we can help reduce their side effects by coming in with that comfortably full bladder. And we give them specific instructions for that. Similarly, we ask that the patient have had a bowel movement before they come in. The rectum sits right behind the prostate. And you can imagine if there's a lot of stool or if a patient is constipated, the rectum will increase in size and it'll push the wall of the rectum closer to the prostate, again, getting closer to that high dose area. By having had a bowel movement before treatments, that rectum will stay empty and further away from the high dose area. When patients ask me about radiation, I have to take a step back and give them the big picture. Radiation is sometimes combined with a hormone shot or androgen deprivation therapy. Testosterone acts like fuel for prostate cancer, and this shot essentially decreases the levels of testosterone and deprives the cancer of its fuel. It's mostly utilized for the more aggressive prostate cancers. The lower risk prostate cancer patients don't necessarily have to receive that treatment. And the radiation can either be external or internal or both. And the internal is called brachytherapy. And so I make sure I review all of these options with my patients because it's not a one size fits all, and certain treatment combinations work better for different patients. Really, the two main treatments are surgery or radiation. Now, they're both equally effective. The real difference comes in the difference in side effects and logistics, frankly, for patients. Surgery often involves, one big operation, but a lot of patients are too old or have too many other medical problems to have that be a safe option for them. There's a lot of other reasons that will lead a patient to choose one or the other. Side effect profile-wise, after surgery, there's often a long period of urinary incontinence. And for some patients, that's unacceptable or difficult for them to manage.